Hello, my name is Karin. I'm a licensed occupational therapist and a medical lymph therapist as well. I've been working with lymphedema patients in Sweden for about 25 years. Over the years, I have worked with compression as the main part of the treatment for lymphedema, primarily for arms and legs as well as for hands and feet. As we all know, there are certain areas on the hands and on the same place on the feet that are particularly challenging to treat with compression garments. Examples of these areas are the base of the fingers and the base of the toes. That's why I'm going to show you how to cut and adapt a Mobiderm pad so that it can be used under compression garments to specifically target swelling in these hard-to-reach areas. It looks like this, and I call it the moose-shaped pad because in my opinion it resembles a moose with his antlers. Now I'm going to show you how to cut this pad. To create the pad, you will need to use a Mobiderm sheet. The version with small tubes is particularly well suited for cutting a moose-shaped pad. You would also need to use a transparent plastic sheet or tracing paper for making a template, a casual pencil to mark the edema on the patient's hand, a marker pen or a regular pen to transfer the shape to the sheets, a small sharp pair of scissors, kinesio-type tape with backing paper, and of course a patient and a little patience. The moose-shaped pad is made in 4 steps. Trace the area of the edema, make a template, transfer the Mobiderm sheets, reinforce the pad with tape to make it durable. Using a transparent sheet to make the template allows you to directly trace the edema from the patient's hand. This ensures that the pad will fit properly and target the affected area with precision. When a patient has a lymphedema in the hand, the area around the base of the fingers is often hard to reach. Fluid tends to accumulate here, forming a small cushion-like swelling, even when using a compression glove. This is exactly where the moose-shaped pad can be placed to help mobilize the edema and prevent skin folds from forming at the base of the fingers. Start making the templates by using a casual pencil. Trace the area of the edema in the following steps. Start between the index finger and middle finger. Follow the shape of the swelling, often towards the base of the thumb. Identify the carpal bones and make a slope around them, avoiding to prevent any unwanted pressure from the pad. Continue by marking the swollen area back towards the little finger. Mark the middle and ring finger with a small semicircle. This will indicate where to cut holes later. Make sure you have enough material to reach between the fingers and all the way around to the palm side of the hand, since the pad should cover the palm as well. Transfer the traced shape to your transparent sheet. Here you can see the beginning of the template, which will be extended between the fingers toward the palmer's side. Mark the holes for 2 fingers, then continue to the palmer side. Now, cut out the template using scissors, leaving extra material extending onto the palm side. You'll refine this later once it's tested on the patient. Next, cut the holes for the fingers. Make sure they are not too large to start with. You now have the beginning of a template. Then try it on the patient's hand. Check the fit on the dorsum and of the fingers. Make the adjustments need to be made, often enlarging the holes for the fingers. Continue with the palmar side section, which needs to be sized so that it remains comfortable with the compression garment. Mark on the palmar side of the hand where the pad should be placed. It should usually cover the palm up to the first crease, below the fingers. Trace the final shape onto the template, then cut the shape. Now you have a complete template for the moose-shaped pad. Place it on the Mobiderm sheet. Try to position it in a way that allows you to use the sheet efficiently. For example, fitting several pads on one sheet if needed. Use a pen to trace the outline of the pad. Mark the location of the holes for the fingers. They will be the eyes of the moose. Use a sharp pair of scissors to cut out the shape of the pad, following the outline you traced. To cut the finger holes, start by making a small notch in the center of each marked hole. Then enlarge them carefully. Now it's time to try the pad on the patient's hand. Check if it needs any adjustments to ensure it applies pressure on the right areas. Start with the dorsum, then check the size of the finger holes to make sure they feel comfortable and are not too small. Then check the fit on the palmar side. If necessary, mark where adjustments need to be made. The main function of the palmar section is to anchor it between the fingers, preventing it from shifting or sliding up onto the dorsum. This size is usually appropriate for the palmar side of the hand. Trim any excess material. Once that's done, you have a finished mousse shape pad ready to use. However, in my experience, reinforcing the area between the fingers adds extra durability. For that, I use kinesio tape, since it's stretchable and has a backing paper. To do the reinforcement steps, ensure the pad is correctly oriented on the patient's hand. Use a pen to mark a cross on the top side of the pad. Place it on the work surface with that marked side facing up. Place the tape across the pad like a blindfold, covering the eyes of the mousse. Then flip everything over so you can accurately trace the shape of the pad and define its position. Transfer the outline of the pad onto the tape's backing paper, leaving about half a centimeter of seam allowance on each side to be folded around the pad. Mark the positioning of the tape on the pad itself for reference. Mark on the backing paper which side is supposed to point toward the fingers. Cut the tape shape, keeping the seam allowance on both sides. Before removing the backing paper, take a moment to double-check the fit and alignment of the tape against the pad. Gently pull to make a rip in the backing paper until it splits from the tape. Heel gradually, trying not to touch the adhesive side of the tape. Fold back about 2 cm of the backing paper and look for the pre-marked areas on the pad. Carefully place the pad onto the adhesive side of the tape. While holding the pad in place, slowly remove the rest of the backing paper, allowing the tape to stick along the pre-marked areas. Use the scissors to make small notches to fold the seam allowance. This is for reinforcing the curved edges to make them stay flat. Next, cut holes for the fingers. Start by making a small notch in the center of the tape. Cut outward from the center for creating small tabs to fold over the edges. It's now important to use a sharp, pointed pair of scissors. Clean, precise cuts will prevent irritation between the fingers. Fold each tab back individually. The tab should form a star-like shape. Now that the mousse-shaped pad is one-eyed, repeat the process for the second finger hole using the same steps. You might expect the tape to come off quickly, but these reinforcements are surprisingly durable, even after months of regular use. Finally, place the pad on the patient's hand. Make sure with your patient that the fit is correct and comfortable, especially between the fingers. And then check the palmar side as well. The moose-shaped pad is now complete and ready to be used with a compression garment. It's important that the patient puts everything on themselves. Then check that it still feels comfortable and that it's possible to use the hand as normal. This will help patient compliance. The pad is intended for use daytime with any compression glove. Inform the patient not to start by wearing it for a whole day immediately, allowing the hand to get accustomed to a new product. The pad needs to be washed on a regular basis. It can be done by hand, but it can be machine washed as well. Some patients may require multiple pads and may wish to create them independently. In that case, you can provide them with their personal template along with a Mobiderm sheet. Good luck with cutting customized Mobiderm pads, like the moose-shaped pad for your patients. Thank you for your attention.